Hi, my name is Chris Elliott. I'm a staff urologist here at Santa Clara Valley Medical Center Urology. I've been here since 2012. Prior to coming to Santa Clara Valley Medical Center, I was a Stanford trained urologist who specialized in incontinence and neurogenic bladder care. As part of my job here at Santa Clara Valley Medical Center, one of the largest spinal cord injury rehabs in Northern California, I take care of a number of patients with spinal cord injury, including my friend Chris here. Those with neurogenic bladder disorders often rely on catheters to drain their bladder, including suprapubic catheters. And while suprapubic catheters are wonderful for patients who need to manage their bladder independently and cannot do so because of poor upper extremity motor function or difficulty reaching their urethra, they're not without their own problems. So here to talk with me today is one of my friends, Chris Bergevin, who's going to help us understand what living with a suprapubic catheter is all about and the problems that may develop.
My name is Chris Bergevin. Had a diving accident. They airlifted me here, had my surgery, spent 2 months in the hospital, and Dr. Elliott here approached me while I was in rehab and said, hey, you look like a good candidate for a suprapubic catheter. I wasn't sure what the drawbacks were at the time. I kind of weighed the ins and outs, and I said, okay, let's go for it. So Dr. Elliott, one of the biggest problems I had, especially in that first year when I was learning, was urinary tract infections, UTIs. Can you talk to me a little bit more about that?
Sure. Urinary tract infections are probably one of the biggest problems we have in those with suprapubic catheters. The problem is that once you have a catheter in place, you will always have bacteria in your bladder. So even on the best day of your life, if someone takes a urine, you're going to show bacteria on the culture. For most people with a suprapubic tube who have bacteria in their urine every day, they're fine on most days of their life. So we don't routinely check for urine infections unless someone's having a fever or feeling really sick without any good reason for being sick. It's important to note that cloudy, smelly urine, urine with debris in it, that doesn't mean you have a urinary tract infection. Generally, we just suggest that people drink more fluid when that occurs because you can wash out the system, and for the vast majority of people, they never need antibiotics when that happens. Overall, our studies suggest that 1 to 2 infections per year are the norm for someone with a suprapubic tube, and it seems to be more within the first year or two. Generally, we just treat those infections as they arise with antibiotics, and most people do fine with just that. A lot of times, patients will also find that if they just drink more fluid, a lot of their troubling symptoms, which aren't a fever, will go away just on their own. For those with more frequent infections, we often can suggest over-the-counter supplements. We can talk about irrigations of the bladder with antibiotics, and even in some cases, prophylactic antibiotics, which are daily antibiotics by mouth. Though we try to not do that because a lot of patients can get resistance to those antibiotics over time, and then when they get a real infection, we have one less antibiotic to treat them with.
Dr. Elliott, another problem I have, urine leakage. And it might be from one of 2 locations, the penis or through the wound area. What can be done to address that?
So another common problem that we face with our patients, especially early on after the suprapubic is placed, one of the initial mistakes that a lot of people make is kind of not having downhill drainage of the entire tube system. When we try to raise it up, the bladder can fill, and then a spasm can cause leakage. Even when we get downhill drainage though, sometimes the bladder continues to spasm and cause leakage. In those cases, we start to think about medicines like anticholinergics, beta-3 agonists, and in rare cases, even Botox injections into the bladder to make it more elastic and less likely to spasm.
One of the most common reasons, at least I still have this issue, is I'll get rolled directly onto the catheter. And within an hour or 2, that'll start backing up and leakage all through the bed.
Yes, sometimes we have to learn these things the hard way, how positioning can really matter with the suprapubic tube. Another thing that could be going on when someone starts to leak is that they're having blockage of the tube, and this is something we always want to take. In your case, obviously a mechanical blockage, but there are other reasons for blockage as well, like calcifications on the tube itself.
One of the biggest issues I have is occasional blocking of the tube. This can set off my autonomic dysreflexia, or AD. What can I do to prevent that, or strategies to minimize those occurrences?
So obviously we just talked about that, a mechanical obstruction laying on the tube can cause this, but it can also be caused by clogging of the tube. And when we start to think about that, we think of three main things that can cause that. Number one, we like to get patients with suprapubic tubes to start drinking lots of fluid. Our goal is to make more than 3 liters of urine per day to flush out the system. This can be a little hard for patients to do in the beginning. Number two, we also try to get the SP tube to a certain size because that's going to make it drain better. We typically try to upsize all our patients to a 22 French SP tube at minimum, just to make it drain a little bit better. Beyond that, even when we get someone hydrating well, we have the proper size SP tube, there can still be encrustations. And in those cases where there's recurrent clogging, we start to look for bacteria, as there's 3 or 4 bacteria that can be in your urine that can cause clogging. When that occurs and we start to suspect those bacteria, we get a urine culture. If we find one of those bacteria, we're going to try to treat with antibiotics to get rid of them and change your SP tube in the middle of the antibiotic course to try to get rid of all nituses that might be causing it. Unfortunately, the little incrustations that can develop on those tubes can fall off in the bladder, and over time those can create bladder stones. So it's very important for all of our patients with suprapubic tubes that we get an ultrasound once a year to make sure that there's no stones developing in their bladder, and if they are, we want to get those out. In cases where we don't find an infection causing it, we've upsized the tube and we still are, have lots of issues, we can think about things like acetic acid or Renacetin irrigations, which can decrease stone formation in the bladder and get rid of these encrustations, making clogging less likely.
I've heard that with a suprapubic catheter, I'm at higher risk for bladder cancer. What's up with that?
Unfortunately, it's true. Those with a suprapubic tube are at slightly increased risk of bladder cancer compared to the general population. The good news, Chris, is that bladder cancer is extremely rare even in the general population, and that increase in those with suprapubic tubes is also incredibly low. In the general population, it's estimated to be around 10 per 100,000. They've done studies to see if we look inside your bladder once a year with a telescope, or if we get special urine tests, we might be able to catch it early in those that are unfortunate enough to develop cancer. To date, those studies have not been able to show that all that work leads to anything meaningful. We suggest, just like the general population, if you start to have blood in your urine on a regular basis, you contact your doctor, because that might be an early warning sign of bladder cancer.
I swam a lot before my accident, and I'd love to get back in the pool. I mean, I've got this tube sticking into my bladder. Is that waterproof?
So that's a very common question. A lot of people who get a suprapubic are worried that they can't do water aerobics therapy or rehab therapy or ever go in the pool again, and that's just not so. The common thought I think most patients have is that the water will go past the suprapubic tube, enter their bladder, it will blow up, and then it'll explode. I can tell you that it's a waterproof site. It's not going to go into your bladder. That's not going to happen. What I suggest for most people with a suprapubic tube that want to go swimming is put a cap on the tube, go swimming. When you're done, take the cap out, drain your bladder, and go about living your daily life.
What if during the exercise I accidentally pulled the tube out? I know it's common sense to put it right back in, but at that point, should I be calling my doctor, or what should I look for?
So while it's probably not perfect to have a tube that's not completely sterile go back into your bladder, as we talked about before, there's always going to be some bacteria in your bladder. Losing the suprapubic tract or having it shrink down or go away would be a worse problem for you than not having a tube inside that was a little bit dirty. I would suggest replacing it and then calling your doctor and maybe getting a new one. So all these have been great questions, Chris, but I realize you've lived the life for the last 8 years with a suprapubic tube. What else do you have to add? Because I'm sure I've missed something.
Actually, I do have a couple of odds and ends. I have a limited supply of the overnight bags. These are the large bags that I empty the catheter bag into. Those, what I tend to do, or what I've learned to do, is add maybe a capful of vinegar or bleach into that bag and keep it in the bathroom with liquid in the bag. Is that all right?
Yeah, I mean, cleaning your supplies, especially the urine drainage bags where you get a limited supply, that's a very common practice. Some people use vinegar, some people use soap and water, some people use bleach. You have to understand that it's a one-way system, so whatever goes in that bag is not going to end up back in your bladder. So all those are very hygienic practices, which are very safe.
One of the other things I fear is that I'm going to knock that suprapubic catheter out. What do I do if that happens?
So this is a common fear that a lot of patients have, and it does come up from time to time. Despite the balloon or the catheter having a retention balloon that holds itself in the bladder, sometimes those balloons fail, and sometimes the tubes just get pulled really hard and it comes out with the balloon intact. In both those situations, it's not something you want to ignore. The tract that the suprapubic tube in is a man-made tract. The body wants to close that down. It's important to get a catheter back through that as fast as possible. It doesn't always matter what size catheter or how clean that catheter may be if you don't have supplies at home. It's more important to get a catheter through the tract and see your practitioner to get a new catheter placed rather than needing to go through a whole nother procedure to get a new suprapubic tube placed.
Dr. Elliott, one of the other things that I've had happen is Friday night, something's wrong, I've got to take out the catheter, or I end up in the emergency room, I need to replace it. Normally I have to come into the clinic with an appointment. What do I do in the emergency room?
So that's a great question because it always seems that these things happen after hours. The good news is that the emergency room has the exact same types of catheters that we use for suprapubics. It's the exact same catheter that we would put through the penis or through the urethra in order to drain the bladder. So they can change your tube without issue. They have the supplies. Most of the time it's actually easier than placing a catheter through the urethra. All they have to do is place it about this far and it's in your bladder. I'm sure you can coach them through it, and they should be able to handle it for you. Well, thank you so much, Chris, and I hope this video is helpful for other patients out there as well. You know, we at Santa Clara Valley Medical Center are here to serve the community around us and those in need. So always happy to help and always happy to answer any questions.